Namaste. This is Dr. Bharti Rajshekhar. I welcome you all for the 20th episode of Gyan Pravah, our series to enlighten and empower. This series has been conceptualized and the brainchild of our dynamic president, Dr. Sunita Tandulwadkar ji. Namaste, madam. I welcome you to this podcast, and I also welcome another luminary who is well known to most of us, Dr. Hema Divakar. Knowledge is power, and when this power is distributed, we become more powerful. And the Dalai Lama said, share your knowledge. It is a way to immortality. And I think this was what our beloved President Dr. Sunita ji was thinking of when she started this excellent session of Gyan Pravah. Today, I would be very brief about Dr. Sunita Tandulwadkar. We know she has a contagious enthusiasm which percolates from the topmost level to the Foxian at the any part of India, because she had an Anubandh program which was an extempore session where we will be discussing the problems of each and every Foxian. And true to her theme, today, Har Ghar Foxian Chalu Ho Gaya Hai. So, with these words, Dr. Sunita Tandulwadkar is the 63rd president of Fogsi, which is a huge professional body of OBGYNs, and Madam is the head of department of the Ruby Ivy Hall Center, and she is the founder of Solo, and she has revolutionized regenerative reproductive medicine, not only in India, but also globally. We welcome you, madam, to this session where Dr. Hema Divakar, another luminary, who is the director of FIGO Women Wellness, as well as she has been the national coordinator of the Manyata program. She has many awards and accolades to her credit. She has adorned many pedestals in her professional capabilities. She is a true leader who has not only focused on women's health care, but also on promoting wellness and preventing illness is something. And she has been a social influencer on legal and health related matters, especially in women's health care. So I welcome both of you to this session, and I request our esteemed president, Dr. Sunita Tandulwadkar ji, to say a few words in this very important Gyan Pravah series. Over to you, ma'am.
Thank you, Bharti. Thank you for your kind words. And I wish you all the best for a fantastic Gyan Pravaha. I know the way you will lead the questions and the way the answers will flow from Hema, it will be really a knowledge of a flow. Many youngsters, I want them to join these webinars, or I should say podcast series, because there is so much to learn from all these experts with which we are doing a conversation. Friends, when I became a president, it was my very, very important initiative that I wanted to be connected with you all. How do I do it? At the same time, I wanted my all chairpersons to do something innovative with the leadership, creative, their own mind, with the passion. I don't want it to force anything. And that's why this Gyan Pravaha, which is a podcast series, since I have 30 committee chairperson, I thought, why not every day, 8 p.m., one committee chairperson on that particular. So if 17th, today we have Bharti, 17th of every month you will have Bharti. Whichever month you have 31st, probably I'll be taking the podcast with some of the spiritual guru or maybe social work or maybe someone. I have not given a thought to it. What is important is connecting with every Foxian, connecting with the society presidents. That's why my Foxy Anubandha series is there, where I connect with all the presidents to discuss the problem, because problem in East India may be totally different from what South India or West India faces. It's very important they should feel that they can talk to the president. Second most important thing is I have started the 7 publications. These are the simple prevalence studies, data collection. When I moved across the country globally, I mean, throughout the India, what I realized is there is a huge talent across the country, huge work, but somehow everyone feels disconnected from Foxy. So I wanted to bridge that continuation. Very important. Who is Foxy? You are the Foxy. Just 10 people don't make a Foxy. So I wanted to reach out to you, and that is why my theme also, though we all work for a maternal and woman health, so the theme is Ek Rashtra, Ek Mission, Swasth Nari Samruddha Vatan, but the most important tagline of is Har Ghar Foxian. Har Ghar of India, one gynecologist is needed. And that is why you exist in the hearts of every family. I love you, Foxian, and you also love my committee chairperson by joining to this Gyan Pravah series, for which they take tremendous efforts. Thank you, Bharti.
Thank you, madam.
Thank you for being. Today, the most important thing is Dr. Hema. I'm sorry. But when I asked Bharti, what are the things you are going to talk? She said her journey. Such an important thing because we all know, I'm very sorry. I'm very sorry here.
Okay, it's okay.
And I don't have cough here. I'm very sorry. Taska lagla. What is important, I need to speak about Hema. Being in one frame of Hema, it's an honor. Hema, I have observed you maybe in last 15 years more. Your creativity, your passion, your thinking is way above where we stop, your thinking stops. And I have learned many things just by observing you, Emma. You was, you were my president when I was infertility committee chairperson. I have seen the way you work. There is a lot to learn. And I'm sure with today's podcast, we will have so many youngsters to see and what they can do in life. Thank you, Hema, for accepting our invitation and making this podcast one of the most valuable, cherishable thing of our Foxy presidential year. Thank you.
Thank you, Sunita. You know, the cough was very symbolic because when you love someone and when you think of them, you cough. So it's the connect. The Foxian connect is very strong and it's saying so. That's a good start for this podcast. I would say it's my lucky day for being with the Sunita Tandulwadkar. And I just looked up on the Google what Sunita means. It means wise. So this is a wise event of Pravah she has created to connect all of us. So thank you ever so much for this opportunity. And all the very best. God bless you with more power to do more. Thank you.
Thank you.
Bharti.
Thank you. As our podcast theme is, now I will just leave and join the routine delegate link. And both of you, I'll be watching you. Have a wonderful dialogue. Thank you.
Thank you. Thank you, Dr. Sunita, ma'am. Hema, as we all know, the journey of life is more important than the destination. And you have been a great leader, leading many, many of us to walk the path for improvement of women's healthcare. And you have been an advocate for delivering quality healthcare. And you have always been thinking ahead of times. So, to set the ball rolling, I would say, how would you think? Let's do it in the reverse order. That how do you think about the present scenario in the women in the healthcare circuit, especially the women's healthcare that has transformed from what it was when you started your practice 3 decades ago, and the journey has reached this present generation, what do you think are those things that have exactly transformed women's healthcare in our part of the world?
Thank you. Thank you so much, Bharti, for inviting me on this podcast, which is aptly labeled Gyan Pravah. Pravah means a flow. So it is an indication that we have to flow with the times, because we have to change certain things, except that in medicine, the very solid foundation, which should not change, is the trust factor. It's the commitment and connect and the rapport with your patients. It's the compassion, the empathy, and ethics. That should lay a solid ground, whether it's previous generation, present, or the future. That is my very strong belief that that value system should never be shaken. Well, there are other things that are happening with changing times, changing technologies, and changing mindset of the society, changing expectations from the doctors. So a lot will happen that's what is called the generation gap, isn't it? Because when you start saying, oh, in my times things were not like this, then you got you got to the next generation. So, and then the word reflections, seldom my thought process and the way I am built is to jump into action without thinking. So the only time I do the thinking is on podcasts like this, and I purposely give the thing reflections because, okay, somebody is compelling you to sit down, think what you were doing before as compared to how you are doing now. And Foxy was born even before I was born. So that is why everybody says taking Foxy to greater heights, because on that solid foundation laid by our predecessors and present President Dr. Sunita Tandulwadkar, see how the new ideas have evolved and getting us higher and higher. And then Foxy has come to stay as a very well recognized organization with hyper enthusiastic Foxians who want to do something every day, every minute, every second, the best that they can do for every girl, every woman. So, having said that, what has changed in the recent past is, of course, you and me talking on this webcast showcases how the technology has helped us connect. And that is, to my mind, I'm completely hooked on to Femtech, as you know very well, that long back when I was called into some remote area and to do an on-site kind of a workshop, the training program, I said, nahi, ek baar jaane se kya hoga na? We are traveling 3 days, going there, doing something, coming. And then what happens to them, we don't know. So now the whole thing has changed into the connect to the last mile without physical efforts of reaching there. Therefore, you can escalate your efforts to 10x. So that is a huge change. The same technology is affecting the girls, women, and patients also. Because today, when we say your health is in your hands, we really mean
They
that
have the
because it's in the
accessibility.
mobile. Okay. So that has both pluses and minuses. There's too much overwhelming information to confuse them. But there is an opportunity for us as clinicians to get into that space, use some of our own doctors as social media influencers who have a great following and they're celebrities in their own right, and then to convey the right kind of messages to the right kind of audience. Because today, if you see the teenagers, they're in a separate bracket altogether. The attempt that we made to have the Yuva clinics and to do the youth-friendly clinics, not happening because they will not come physically to our clinics because it stigmatizes in a way. So now the connect is there on the tech platform, and then, anonymous, confidentiality, everything. Then when you go to the reproductive, again, right from egg freezing to all the ideas that, you're challenged with as of today, sometimes like I will not call myself old-time practitioner because we are moving with the times. We have to be contemporary, seeing what is the scenario now. It's Beti Bachao, Beti Padhao. Arey, if the Beti has graduated and then she's excelling in her career, then she may think differently on certain aspects of fertility issues also. So all the way, your idea should be not to impose your idea there, but to support her idea. And that's the changing times which is happening, Bharti, because every age group, teenagers, I told you one bracket, reproductive, okay, and then the pregnancy instead of bringing joy, maybe bringing anxiety, and then have I missed out something? Am I performing well? Even right from antenatal to breastfeeding, this issue continues. Then menopause, now they've come to recognize that menopause is an issue. Okay, that itself is a great change. Okay, then they are proactively coming and pitching their problems to us as clinicians, where they used to only come in that age group for a hysterectomy, maybe. They're like it's coming to their neck and they're bleeding. Like, okay, come remove the uterus. That was the 40 plus scenario. Now they finished the reproduction. That's the only thing that's remained. Now it is conserving the uterus, save the uterus campaign, doing a lot for the menopausal issues, which may cause social and career and the health barriers to them. So there is a lot in every age group in a journey through the ages. It is changing, and we have to really, really live up to it, not only in a technological, or the subject wise, but also the buffers of the social settings in which the scenario is changing, because medicine is not all about, you have to really, really, there was a phase where we were, the right ear and the left ear did not, there was a separate specialist for that. But now the holistic healing,
Realistic.
again, integrating everything, taking the girl, women as a person and addressing that. Life is a circle, Bharti.
Yes,
Whole
true.
way around. We had those general practitioners, family doctors, went to
We're going back.
specialist, got nicely divided, diverted, and then now we are coming back to
Yeah, back.
holistic again. Yeah, so that's how, when I reflect, that's how it has been. But we are lucky to have seen it all. But
Yeah.
still we are learning. There is
Exactly.
more to
There's a
that's the
pravaha.
wow factor. That's the
It is
awe
flowing.
in which
There's
we live.
lots to
Yeah.
learn.
Yeah.
So Hema, you have very well brought about the change what we are seeing now. So what I would say is that, as you said, it is a pravaha where we have to move, and of course, as you said, we have to change the way we look at a woman, or look at a lady, or what we are doing. Like you say, menopause is no more called menopause; it's called midlife. So and mental health issues. Women are coming out and speaking about mental health issues. Today, we are more focused on promoting wellness and
Absolutely.
preventing illness, and coming, as you said, into a holistic aspect of managing health in the woman, which I think is a very, very positive movement that we are seeing, because we are addressing her spiritual part of her, the Atma as well as the body is being addressed. And I think that's how any individual will have perfect health only if they are addressed to as a whole, rather than, as you said, you just see her uterus, you just see her ovaries.
And the present president is nicely locking in
Yes,
the
lucky.
body, mind, and soul,
So,
aspects of
yeah,
the holistic healthy journey. And we are delighted about that
true.
concept.
So, in this aspect of promoting wellness and preventing illness, we have started quite early in many aspects of girls' healthcare, I would say. So, what do you think at the present scenario is a game changer in the Indian scenario in promoting wellness and preventing illness?
Okay. One major scientific breakthrough for the young girls today to give a healthy generation next, which is our responsibility, is the advent of the HPV vaccine. Can you just imagine? People cannot believe that the cancer is driven by a virus, and then you can actually, like a polio, drops for polio, you can actually give the HPV vaccine to see to it that the cervical cancer is eliminated from the world, like how the polio went, the leprosy went, the tuberculosis, now
Smallpox.
Nikshay program is happening. Just imagine a world where no women has to have cervical cancer, or no women has to die of cervical cancer. That is the dream which we have to make it come true by acting now for a better tomorrow. So a single most focus, हर घर में फॉक्सियन, तो हर फॉक्सियन के मन में
Cancer service prevention.
जिंदगी के.
Roti
That is
ki
also
zindagi ke.
that's also aligned with the president's theme. Just awareness is not important, Bharti. Awareness to action and accelerated action. I have to specially congratulate you and
Thank
your
you.
team from the Karnataka OBGYN Society, which has taken the lead, because we were told by our health minister that no, Karnataka has to become a role model. So we said, screen the mothers, vaccinate the daughters. Then you led the champions across Karnataka. Thousands of vaccines given. 2025 is our year. And we are not going to look back and stop at that. So 9 to 14, now the new protocol of 1 dose. Okay, you give the offer for the second dose, but at least 1 dose for all the outgoing school students. Just imagine 30 years later, somebody will be doing a podcast or even some AI related whatever kind of a program, augmented reality, where they will say that because they gave this vaccine 30 years back, today the
Today we have.
scenario is like this. That's how we have to actually try and get this movement across. So I think the HPV vaccination drive has been one of the most important thing for preventive care for the adolescent. As a division director of the FICO Well Women Healthcare, we have drawn wellness on wheels. In that wheel, at every age group, there are certain things which is mandated that you must do towards preventive care, towards wellness, towards getting her ready for the next phase of her life. So adolescence, one important thing doable and which will have an impact is the HPV vaccine.
Yeah.
Another is anemia correction. Another is, you know, way back we used to think, oh, this is pregnant and she's coming with 4 gram hemoglobin and this and that. How did she get into the phase of pregnancy with that kind of a anemic status? Why didn't we act upon it before she became pregnant, or even before she got married, or even when she was in school? You rewind, take it back there. We had enough and ample opportunities to do. So HPV vaccine, anemia care, menstrual health and hygiene, lifestyle obesity, and sexual health and the know-how, the Gyan Pravah to that age group, also which can be easily done by the digital technology methodologies and mechanism. And we are hugely promoting now in the school children because there were many questions asked to us about menstrual cups, the use of menstrual cups. So they are very, very aware of the environment and
Sustainable,
the climate change. They say all these pads will have to be burned somewhere, thrown somewhere. The waste disposal is an issue. So there are many schools who have had these young children into their SDG council, they call it. They go and campaign for the menstrual cups and they tell their mothers, Ma, this is the new thing. See, because it's like those who are using pads, it's a behavior change. They will not be able to get it. But if first time you start using the menstrual cups, then you move ahead from there. So menstruation, anemia care go hand in hand because they're like two sides of the coin. If you bleed too much, it's not plugged, and then you get anemic and just no use of just correcting your iron and B12 deficiency. So this is a very, very targeted age group where you reap as you sow. So you
True.
sow the seeds of good health in the adolescents today. Definitely you'll have a better tomorrow. That's a firm belief. And I think Foxy and every of these matters is doing a lot. I would urge all my champions across the country to make this a role model for the entire globe so that they learn lessons. And Kiera, who is our FIGO president, says South-South collaboration. South, we are the ones in India who will showcase that besides being such a challenging country, so
True.
much of
True.
diversity,
Yeah.
but still, Ek Rashtra, Ek Mission.
Great mission.
It is there.
True.
Okay,
Yes.
that is there in all our minds. So that's
Yeah.
how.
Yeah. So as a team, we can achieve more, as you said. So when all of us Foxians get together and we think about nurturing the future, I would say, let
Yeah.
us start nurturing the future, because gone are those days when we hardly saw any adolescents in a gynec clinic. They would either have a pediatric problem or an influenza or some upper respiratory infection. But no, the days have changed, as you said. Girls need to be, and we have a huge platform on the digital thing where we can tell them about sustainable menstruation, about lifestyle management, about nutrition. And that's, I think, a major change in how we will, in the next coming years, we will see, as you said, anemia in the preconceptional stage. If it is tackled, we are definitely going to see a huge intellectual outburst of the to be born future Indians who are going to be the torchbearers of our country.
Bharti, the 600 vaccine campaign that you did, and in one day it was a phenomenal success, and now it's 1,000. It stepped up to
Yes, next
1,000.
week.
Was there any hesitancy, or are these girls and the parents now wise enough to come
Well,
forward
I would say
and take her advice?
the parents were so enthusiastic,
Mm.
and we had lined them up at around 7:45 a.m. in the morning in
Wow.
a very remote village where it was in around a temple. It was in the Samudaya Bhavana of the temple, and the parents were there with their children at 7:30. and they were lined up. There was a systematic registration process. There were pamphlets, flyers given about the awareness. We had already spoken to them about what is the vaccine, why it need to be given, and children. I was impressed by the father coming with his daughter. See,
Nice.
that was what, see, they have realized that beti padhao nahi, beti bachao also is very, very important. So they were
Absolutely.
there.
And you said temple premises, so may the gods
Yeah,
bless me
yeah,
always with
exactly.
you, because Sunita's programs also, they're, tied up with religious leaders and the
Exactly.
religious places visit and all. So that, I think, to my mind, you may want to have 1,000 ideas, you may want to execute 10 of those, but when you get into action, there has to be an enabling environment by the universe to make this work.
Very true, very true.
Yes.
That connect has to be there. The
Absolutely.
spiritual connect, if it is that calling, that spiritual vibe is not there, I think even if we put a lot of effort, sometimes things won't happen. But I really think that was a spiritual connect for us, because funds just started flowing in for us, even without asking. We had 600 children vaccinated with a very well organized camp, with the healthcare personnel around, with our own gynecologist from Hassan Society. We were giving the vaccines ourselves. And then there was another registration at the same thing. They said another 2 weeks, we're going to have 500 more. And today I am lined up for another 1,000 vaccinations, because the parents have come voluntarily, registered themselves, and they've got the documents and the consent form signed. And it's systematic. It just moves like the Kumbh Mela, like the pilgrims are moving on the plantoons. We are seeing the girls moving, with most often the father of the family brings his daughter. She gets her vaccination. She takes a photograph with us. She smiles at us. We give her a peanut chicky. She eats the peanut chicky. She waves at us and she goes back. That's such a wonderful scene to be visualized. Like I would say, it's a health kumbh mela, So I wish that every person, gynecologist around India would take this up. And as you said, we can definitely reach the WHO targets of 90, 70,
And
90.
Bharti, to imagine that last 30 years, 35 years in practice, we've been struggling to convince women for screening. The
True.
pap smear is like, the percentage covered is so pathetic, and we are unable to have a handle on that. Now, self-testing, HPV tests, and the screening methodologies, which are giving us a yes or no answer. HPV is there or not there. So this also needs to be escalated. That's why I said Pravah, because what we were doing before, why it did not work. Okay, guys, there were concerns and we were, now can we do better?
Yes, we can.
Okay, and all the time not looking at somebody else who can do better. We have to take the first step. And then the wagon moves ahead.
Yeah, it starts with a small step.
Absolutely.
See, the clinically, every person is given awareness. So we know that women are coming back and asking us, Doctor, my neighbor took this vaccine. What is this? My neighbor or my friend got this screening done. I need to get it done. So that is, I think, a definite transformation we are seeing, women moving towards wellness.
Yeah. So the demand and supply should match, Bharti, because we have to sensitize all our Foxians that if they are coming to you proactively, you make it accessible to them.
Accessibility. Yeah.
And then give them enough amount of information so that
there is no misconceptions. Yeah, there's no misconception and there's no hesitancy. So moving ahead, as you said already, you spoke about the sustainable menstruation and the paradigm shift from to sustainable menstrual cups, or it may be the eco-friendly pads. I think that is due to the accessibility by the digital platforms and the humongous information we get on this. So then now, very important, we know that India has made considerable success in reducing the maternal mortality, though we still have pockets of an increased maternal mortality, which the government of India, as well as all the 45,000 Foxians, are trying to see that no mother dies because of childbirth. So what would you say are the changings, reflecting on what it was when you started your practice 3 decades ago to what has become the birthing process, the birthing companionship? What are these shifts that you see which are for the betterment of women's health? And she feels that a confinement or a birthing process is going to be, I deliberately don't use the word delivery here, because all of you must have heard our immediate past president, Dr. Jaideep Take, saying deliveries are by Zomato and Swiggy, women only give birth. So what do you think are the transformations reflecting across your 3 decades of practice?
This I will start the reverse way. That what used to happen about 35 years ago, we, usually had only the women with a mother or mother-in-law, and I used to insist that, where is your husband? Do you have
Yes.
a husband? Call him inside. I want to speak to him. नहीं नहीं वो नहीं आएंगे उनको क्या पड़ी है ये तो हमारे problem है. That type of a mindset, and the girl also did not have a voice, and then it was a completely, he was kind of dismissed. So I was insisting that no, I really need to speak to him at least once during your several visits, because I just need to see him. And then even from those days, I was like, insisting that the husband should stand by for the delivery,
Yes.
because they could to say what she's undergoing. And then, especially after that, their, mindset about the kind of efforts that a woman needs to make. It is very happily called joys of motherhood and all,
Yeah.
that journey of pregnancy, but it is not very easy. Those days we didn't have the pain relief also in every small little nursing home, and epidural was
True.
not so popular even. So the pain part was there, and then I used to always think in my mind, at least if he sees this, then he may give consent for tubectomy.
Yeah, true. Very true.
So let him see what is.
Yeah.
So that was it. So they used to hate me for that, because ये doctor तो मुझे बहुत force करती है जया आने के लिए and all that. So but some slowly, and now husband, do you allow the husband to stand with me, doctor? That's okay. I said,
Yeah.
from 30 years I'm telling the same thing now. So now they have started asking for it, and then only during COVID times we had some constraints.
Yeah.
But we said, when we say a birth companion, I remember that once we went to this Dr. Daftari's labor workshop. Okay, so they had lined up 20 patients in the delivery rooms in one of the government colleges in Tamil Nadu. And
Okay.
our team went, like big things to do, a lot of things. Then the companion program was very much on in the government sector in Tamil Nadu, and each of the laboring patient had one person. And I was really, really impressed with that. But the superintendent or the head told, no, today the guests are coming, and then they're going to demonstrate some things, and we cannot allow you guys, and everybody, they shoot
Out.
them out. But somehow the district collector or somebody in the government got this information. They came and they just fired away all of us. That no, who are you guys who are driving the companions away? We think it's really crucial. So
Yeah.
the public and private sector scenarios are different, but where there is a will, there's a way. And then they made it happen. It has not been, easy to execute it everywhere. Because
Everywhere.
I know that on some delivery tables, three women were lying down, and then we have gone to emergency obstetric care program of Fogsi with Dr. Harshit Sanghvi, myself, Uday Parul, went to major medical colleges right across the country, and it was quite an eye-opener about the
The
kind of resource
situation.
constraint and the
The
space
situation.
constraints they're
Exactly.
having, and the load that they're having. It is a huge challenge indeed. From that time, the quality care, this is not what our women deserve. We have
True.
to do better for them. That was always a burning kind of a desire. And slowly the government also came to recognize, if 50 to 60% are having their care in private practice, we must have a mechanism to ensure that even in private practice, the quality care is given. Again, I must thank Foxy for stepping ahead with the Manyata initiative more than a decade ago now, to start training the teams in the private hospitals
True.
towards giving a positive birthing experience, respectful maternity care. And Bharti, you won't believe, first module when we introduced respectful maternity care, isme kya hai? What you want to teach? What respectful maternity care? Like this, we were shouted at. And then I said, at least see to it that she doesn't scold or abuse or
Yeah. True.
hit
Yes.
because staff is also less, and they're also frustrated.
Yeah.
Get over with it. So all kinds of things. We know the ground realities. So slowly it started evolving into, they actually understood what is quality care, what is communication, what is respectful care, what is a positive birthing experience, how you comfort the women in her most significant moments of her life, and really make her feel blessed and satisfied with the bundle of joy in her hand. So that's a completely a transformative change. So we have come a long way with serious attempts to get this on ground. And now the staff need not be told. Spontaneously, their culture has changed.
Yes. True.
Because they've recognized that by doing this, they're also happy.
Yeah.
In the
Vibes,
whole process.
the
And then
vibrations
now
are
the
different.
epidurals, etc., available. So we talk to them in advance, we offer them that. And then there was a huge ruckus about cesarean section at request. Is it ethical? Should you do it? Should you not do it? The debate may still continue, but every supervised delivery will get you to where that process has to go and when you have to intervene. That is a simple message, because oftentimes, without the labor monitoring, just because of a human constraint, or here again, the technology, like the cardiac people have a centralized screen where you
Monitoring
can
system.
see what's happening to the heart of every patient. Then there is somebody in the superior position of supervision who has a keen eye on all the labor patients,
Photographs.
not running from one bed to another. So even with less human resource, how you can manage through technology, and how the alerts are given by the machine themselves. Not that it should only be machines, but
Yes.
if there are 4 patients in labor and 1 staff nurse and they are at different stages, if my
She
system
sees the
beeps, then
beeps.
I know I have to go there first. So at least she can sort out her priorities. So all of these changes are happening. And I think with lesser and lesser number of deliveries that they're having, and nothing is to be taken for granted. So antenatal care, interpartum, paying attention to all minor details, and postpartum, to connect with her again, if not possible, home to home, if not possible, for her to visit the hospital. Again, telecalls are there. Contraception has come into place. PPI-UCD was a big program by Fogsi. Every patient who delivers today needs a contraception.
PPA said.
Okay. And half of them are in a dilemma whether to go in for a permanent methodology of sterilization or not. Vasectomy still 1-2%. If the percentage increases by half, also so much in media splash and everything. So that is still minuscule. So women themselves have to do something so that they don't have one pregnancy behind the other, because frequency of the childbirth itself pushes them into high risk, that we all know. So if there is a mandate that for every patient delivering in your hospital, you offer some kind of contraception, which is well in our program, then at least half the unintended pregnancies will not
True.
happen. So all of these, I think there is the needle is moving only forward, for sure. And of course, there are a few grumblings and mumblings, and there is too much over medicalization, too many tests that the doctors do. And now, it's a mix. Before, we used to ask, oh, just because this doctor has bought a scan machine, she's exploiting and she's doing the scan. Is it really necessary? In our times, it was not there. That was like 35 years back. Now they're asking why you're not doing the scan.
Yes.
Previously, they just, too bad. Arey, ek baar to dekhte ho na. No. Couldn't you have done before? There are lots of questions asked. So every season,
Yeah.
it brings with it their own pluses and minuses, but it has been, as we said, we are evolving, we are learning, we are doing much better. Because sometimes in the West, there is no way you can track the same patient for a comorbid copy. Suppose my patient has hypertension and I want her to come for an annual checkup to me for a comprehensive care of the long-term problems that the hypertension can have. I still have the liberty to do that. But
Absolutely.
abroad, they have to go to a GP, or they have to
Family
go to a
physician.
concerned specialist, and they cannot go back to
The
their
connect is
ophthalmologist.
not there. The connect
Yes. So
disconnects.
so
They
I
get
think there is
disconnected as soon as
a
they're
lot
out
that
of that
is, we are blessed
category.
with a lot of liberty to
Yeah.
do the things which are the best for our patients, for sure.
Yeah. And the one thing that's nice in India, what I feel, is we have families
Yes.
from the grandmother to the daughter and then the grandchild who come to us again for their pregnancy issues. And
I
as
know
you
they
said,
bring the patient every day, almost every day. There is a newlywed couple, or they're married since 2 years, 4 years, and
yeah.
now they're planning a pregnancy. Then they will come. They'll say, "This was born in your hospital." I said, "Such a big Hulk now, a big man." I had a lovely lady, years ago. And then there was one who said that, doctor, I was second of the twin. My sister, she slipped out easily, but after 2.5 hours, you did my cesarean
Yes.
section. And that time, my pediatrician was also like very tense up. The second baby is not coming out. What's the kind of decision I'm going to take? What kind of baby she's going to get? And my great husband, Dr. Divakar, is reading then and there. Oh, today there's an article in the newspaper.
Can
I picked
wait.
the second baby delivered after 1 week.
Yeah, you can wait.
And oh my God, no, we are not good. And then we had to quickly think, rethink, and then do a C-section. So that boy appeared with his wife, saying that I was the second of the twin who was born
Okay, that's
by
wonderful.
C-section, but my sister delivered normally. And then, there was some lady who came with, देखो आपका paper मैंने फिर से रखा है. It's a second daughter coming for the delivery, but she had kept all my antenatal notes and the discharge summary and the C-section bill of 6,800 rupees. Those days, say,
Yes.
of course, Rakhi. I said, oh, okay. So the trust is something, no marketing, no, fancy deals,
Yes.
nothing
It's
pushing
just
down
trust
the
and
road, but
compassion.
still they look for you and come. And that is the credibility that I wish each one would establish, because they want to come back to you for the trust factor and the confidence that you will do your best for them. So that is what, over the years makes us look back with satisfaction, if not anything else. Yes.
Yeah, very true, Dr. Hema. These small, pleasant moments when they pop up when you're in the marketplace or in a wedding and somebody just runs up to you and says, "Oh, doctor, you delivered my mother, and
Yes.
I am a singer today, or I'm a software engineer," and they want to take a selfie with you. I think these are such nostalgic, memorable moments of an obstetrician. Because sometimes when we are in the labor theater and we are stressed out, we say, "Why did I become an obstetrician? Why couldn't I be sitting behind a desk and doing something more comfortable?" But I think those are im I mean, you cannot even weigh them with any amount of any type of wealth. I would say those pleasurable moments only
Absolutely.
an obstetrician can have in her life. I would say, and those are the moments I do really, really treasure in my life. And then now
Absolutely.
moving ahead, you've seen this. The birthing technology has changed. We have the digital platforms there. We have respectful about companionship and things going on. And as you said, the Manyata program, which was taken up by the Foxy to train our healthcare workers with the soft skills of communication, soft and the documentation process has made a major transformation, because my hospital, being a Manyata trained, I can see the changes. I can see the shift in how these girls look after those women who come to us, as you said, at the very most important juncture in their life. And the transformation in the male partner also has changed, though still we need to address those
And
things.
Bharti, you mentioned about the mental well-being. Really, the
Yes,
perinatal mental health has become a huge subject in
true.
itself.
Mm.
And the more we pay attention to that, depression, anxiety, etc., which the patient, every patient almost carries with
Yeah,
the said and unsaid.
yes,
That is the thing. So we have to be very, very sensitive about that. There are some checklists that have been bought, because nutrition and mental well-being right across that wellness wheel we have put across all times in life. But the Figo nutrition checklist, for example, or the Nimhans and Japago and Foxy have come out with the perinatal mental health care checklist. So never ignore that, because it
yes,
has to be flat and it has to be paid attention to. Even a few reassuring words. You may be really busy,
yes,
but
very
what
true.
you say, even two words matter to her a lot. She carries that with her and remembers it forever, because that may be a game changer, as you said, for her, that she has the confidence that everything will go well. So that
Very true.
agony, that we have to be very, very sensitive to that. Yeah.
Yeah, very true. So, just a few words of empathy or just a little compassionately you talk up, and they generally open up. Otherwise,
Yeah.
most of them, as you said, they do not speak about their mental illness. I think it's the duty of every OBGYN, however busy we may have, we have to make some time and just ask her a few questions about her sleep, about her how she's comfortable at home, and that makes a very huge difference in how she goes back home and connects with her child, connects with her family, and connects with the society. And I think that is one thing we should not neglect. I rightly agree with you, Dr. Hema. Well, we have moved on from adolescence, from prevention, we've moved on to PCOS, so you know that, and we're not going to talk much about that. Then the birthing skills and contraception, we have come back. And then, of course, we have to talk about the women in midlife. Because no more are
Mm.
we using menopause, because that woman there says, me no pause. I have a long life even after my menopause, which is just a physical symptom of my
That is
menstruation
true.
stopping.
Yeah,
Because this
absolutely.
is when I'm going to live my life. So, what do you think are the changes you're seeing in the present scenario in this aspect
Yeah,
of
when
women?
I was a Foxy president, we had, one word coined, NULIFE, new life.
New life.
So Maninder Ahuja was like, how passionate she is
Yes.
about the
Yes.
menopause and the issues around that. So I had told her to take charge. Maninder, you have to do this new life clinics because it's a new life truly, but many things gone behind her, and we have to project it in a positive way so that women and the families can cope with it.
Yeah.
The hormone, nor hormone, this, that, where the mood swings
Confusions.
and the tantrums that they may throw, the value at the workplace also somehow, it hurts them because their own value, even the payment and the
Yeah.
number of hours of work and the fact that she can contribute with her wisdom is
She's
not
more
taken on
productive.
board.
Yeah.
So they are made to feel very different, even at home and even at workplace. So that is a very sensitive matter in itself. But the comorbidities that she may have carried through the
True.
pregnancy, which will unfold now, the early cancer detection, which will happen, those are all the proper technical things that everybody at every touch point start guiding them well before they reach menopause and get on to that. And then the last part of it is actually the physical problems that she may
Issues.
have, like concerns with the uterus, menorrhagia, and some
Sexual health.
tumors or whatever you need to take care of, some conservative methodologies and some otherwise. But the buildup of type 2 diabetes, cardiovascular problems, and everything that the menopausal age group carries with that, we have to often tell the patients that these are the expected problems. You to come to us because many times
Yes.
I've seen them go to the psychiatrist first
Very true. Very
because
true.
the way she is
Yeah.
behaving, the family first takes that. Then even if she is having any other comorbidity other than her pregnancy and the problem for which she thinks we are competent to handle, she never even will mention it to us
True.
because she
She
doesn't
thinks,
know whether
yeah.
those questions have to be raised in our chamber.
Yeah. Yeah.
So we need to guide her to just create such a
True. Yeah.
confidential and confident rapport that she just about parks everything with us, and it's for us to check and flag it to the next level of specialists or the other partners of counseling. And then again, in her new life, help her guide through the 360 degrees. Here again, the anonymity, confidentiality is very important, and access is enabled by the again the technology platform. Because see, one old lady in the house, I'm not saying menopause, old lady, 40,
Yeah.
50 years, sometimes there are constraints of her coming to the clinic because she have to request somebody else in the
Request
house.
somebody.
Everybody is busy.
She's not
Okay.
she has to depend on somebody.
Even in the urban,
True.
everybody is busy. Rural, there's another set of problems. There's nobody to go to. So she has to have a go-to person. And then, everybody says the human touch is important, touch and feel. But touch her heart with the tech. That you get you when she needs you, if you're available to connect, it makes a huge, huge, huge difference. And she doesn't sometimes relate to what's going on because it's a bizarre,
Yeah.
basket of symptoms that she's in. And then there is a total fear and anxiety of the cancers.
It's
That's for
true.
sure, because
Yeah.
somebody in the
Very, very
office,
much.
somebody at home, they know, and therefore they don't want to come to us because
Exactly.
they're worried that what we will tell them. About what's a
To face the
misinterpretation.
reality. They're scared to
Ah,
face the reality.
misinterpretations, overcalling things, not talking to them in a reassuring way. It's a very delicate balance that we have to strike. We have to give her the warning that she needs to pay attention to all these. And every time she comes, she should be guided for what's new and what better she can do for her own health. Again, the same mantra which you mentioned, Bharti, prevent illness and promote wellness. So we want our women with a quality of life,
Yes.
for ever and ever. And for that, the preventive care and wellness, integrated health and well-being centers, and even within your own setting, something about wellness, if you focus proactively, ask them
Yes.
and try to do your best on that segment. Even the corporates and all, they have the wellness program, But I believe nobody is actually only 2% or 10% avail of those unless you make it mandatory. And
Yeah.
when you make it mandatory, it's all fragmented. They go to many specialists in one big setup and they're all more confused.
Yeah.
So that
I
also.
think that, and especially in midlife, I would say it has to be integrated medicine and it has to be a holistic way of managing things, because most of them, they do have comorbidities which may be under good control, but it is their mental aspect and the other parts which they do not speak about. So I think we need to have focused clinics, or maybe take time out of the general outpatient that we are doing, and maybe have some satsangs or have some awareness programs where once a month these women come to us, because as you said, the human touch and just speaking to a doctor whom they confide in, and those vibrations they feel in that room when they're not talking to somebody taking the blood pressure or somebody doing her blood test, she just feels good. Because
Yes.
very often, I think you must have experienced the same. I have few women who just come to say, Doctor, I've just come to say to see you, because when I come to see you and I go back home, I feel very happy about it.
True.
So these are I think things that because it's not that they just feel the vibrations, and that compassionate 2 minutes of talk with them carries their health
The
in
message,
a different
Bharti, is very
direction.
important because at least now they're actually coming to us. Because
Yes,
in the Esther years, this age group would not come
yes,
unless they have it in
and
their mind that it's getting too much now, I need my uterus to be removed.
yes,
Unless that was there, they used to really not drop by at our doorstep. And they used
yeah,
to be
either
busy
bleeding.
delivering right until menopause. Na?
Sure,
That was
yeah.
also there. Year after menarche to menopause, like how my mother-in-law, menarche to menopause, then nothing really happened. So that's also there. And then they feel that such a large family, we are becoming a burden, whether it's a prolapse, whether it is SUI,
Ex-
whether it is, any discomfort, whether it's anything that they have to bring to the notice of the family members, it is still, kind of some barrier in their mind.
Balance,
They
yeah,
don't want to upfront tell. They want to just adjust as long as they can. And oftentimes we miss the bus because they come too late.
late.
So this bus has to be created. And I don't think today's generation, the way they're empowered with everything that they have to do for themselves, if little bit they're guided to take care of themselves, I think all the way across from
Sure,
adolescent to reproductive
yeah,
to menopause, the scenario is going to change.
yes.
Definitely. And it should. Why not?
So I think, Dr. Hema, there was excellent reflections on the experiences you have gone through. Are there any hurdles that you faced, or any sort of something that you go back to and think of that there was a hurdle in whatever vision I had, what was I wanted to implement? And do you think that there are any such hurdles in the present scenario today also?
There will
Challenges.
always be hurdles. 5 years hurdle. But you should have the tenacity and capacity to jump over that
Very
hurdle.
true.
Because
Yeah.
everybody only
Never give
will
up.
know the success stories.
Yes.
Okay, to
Yeah.
introduce that parental iron into the Anemia Mukta Bharat policy, 318 times I've gone to the government setting to say, sir, this is what we've done in our rural area. Sir, the reports are very good. Sir, the publication is there. So this will be very useful for our women. कोई सुनने वाला नहीं. They will not, but we are very hooked on. No, this has
Yeah.
to come. This is
Perseverance.
because
Yeah.
so many women are dying of anemia. So very, very different. Very much a hurdlesome. If any group wants to get together and brainstorm, there'll always be 10 people saying that, no, this will not work.
No. Yeah.
No, this not. But you have to, convince yourself that you have to try your best to begin. To win, you have to begin. That's a mantra. Okay. But you have to have the mindset that it'll flop also. So many of my projects have flopped also, but it's fine. But at least I've
Fine.
tried. And
True.
in that, if you remember, Bharti, when you were the president of Karnataka Society, I launched the ABCDE program.
Yes.
Okay. A for adolescent and anemia care, and the policy change for parental iron has been bought. Anemia Mukta Bharat is like well on its way to the road to success. B is building contraceptive choices. Again, the PPIUCD program from 2%, it increased to 44%. So that's a good thing. The C, cervical cancer, screen the mother, vaccinate the daughter, was a major flop last 12 years because, madam, don't come here to sell your vaccines. That's what I was told at the Central Ministry when I used to go and say that, sir, this is really good. And then screening also from VIA to pap smear to HPV test. They said 214 gynecologists we've rung up and nobody is doing HPV test. So what are you coming and talking to us about? Okay, in private practice, sir, they're doing. No, madam, this is your list. This is the Foxy. So that is, they slapped the data
Proposals.
on the table. So that gave me insights. That's how you see the board there, artist, Asian research and training. Research is implementation research. What works in our country? What are the knowledge attitude practices? What may be the gaps? How we will overcome that? So that is where the whole journey for this implementation research started, and training, demand generation and supply. If women know, they'll come to us, but we are not offering the best. That's a problem. So the C was stuck for a long time, and Dr. Parimala's tagline, kill it before it kills you, is now coming to shape, because now we are able to progress and move something. ABCD, the D was diabetes. That also the single step test. We fought our way through the global organization FIGO, and we said, no, in India, we can only do this because women cannot come to the centers in a fasting state from 200 miles. But now we have a technological solution. It's just like a bangle. They can wear it, and it's a continuous non-invasive monitoring. Fasting, 24-hour glucose can be studied, and we can guide them properly. So there is a progress there. And then E is emergency obstetric care, which we did with Foxy and the government 30 years back. And the Manyata program reflects the same thing in private practice in the present. So the ABCD is, rocked back and forth, and all kinds of hurdles. We become seasoned in facing the hurdles. So something goes on very fast, very smooth. We're surprised. Like our vaccination program. We just started in second half of January. And then, so much has happened for screening and vaccination. I said, wow, it was waiting for 10 years to have this moment of success. And now I think it will snowball and like wildfire throughout the country. And I do hope that this mission of the C for cervical cancer also becomes successful. So be prepared for hurdles all the way. And once you prove your credibility, once you persistently stay there for long enough, focused on you have to do this, you have to learn your lessons, make course correction, drop some projects if they're flopping because the ideas may have been different, the scene has changed, you cannot get moving. Fine, change your course, be flexible in your mind, be ready to accept failures. Persist for long enough. Don't compromise on your value system. Get the needle moving forward, however slow it is. If it's a forward movement, you please welcome it and get moving. Get going. That's what my sincere advice would be.
I think
so
that
test,
is
don't let the people or the environment test your patience. Be patient.
Yeah, be patient. I think that is your mantra. And that is what has taken you forward, and you have moved the pendulum very, very much. And we have seen, as you said, the ABCD is on track now. And I'm sure in the coming years, women of India will have complete holistic health from the day they are born to the day they leave this
Bharti, the E
world.
means etc. also. That's why they call it ABCD, etc. Because there are so many things that we but one thing at a time.
So
and each one is cut out to do one thing. So we all.
So I think you have been expressed your views excellently, and have been a motivator and an influencer to many of our listeners over here. And we come to the end